This lecture was made for parents who have children that may stutter. It is important that parents will understand what stuttering is. Parents need to understand the risk factors associated with stuttering and how someone will assess and treat your child. I will also discuss some tips that parents can follow to help their child who stutters. I will first speak about what fluency is. Fluency is the ability for your child to speak clearly. This means that the child does not have any interruptions in their flow of speech. Fluency disorders is when the child has difficulties with producing speech. Stuttering is a type of fluency disorder which is characterized by breaks, which disrupts the flow of speech. This will affect your child's ability to speak clearly. Today, the cause of stuttering is not well known. However, it is believed that a different number of factors, when combined together, will cause the individual to stutter, and this will be different for each individual. This is what makes stuttering a complex disorder. There are certain risk factors that need to be identified which can cause your child to be at a higher risk for developing stuttering. Stuttering is 4 times more common in males than in females. If your child is below the age of 5, they will more likely stutter than children who are above the age of 5. If you have someone in your family who stutters, such as a sibling parent, or if you yourself stutter, chances are that your child will also stutter. If your child has been stuttering for a period of 6 months or longer, then they will most likely continue to stutter. There are certain behaviors that a child who stutters will have, and these behaviors are called stuttering-like disfluencies. There are 4 types of stuttering-like disfluency behaviors, and they are part-word repetition, single-syllable word repetition, blocks, and prolongations. Part-word repetition is when the child repeats part of the word. For example, my dog is small. Single-syllable word repetition is where this child repeats a single syllable, and an example would be I love candy. Prolongation is when the child makes the sound, particularly a vowel, longer, and an example would be look. A block is when there's tension in the child's flow of speech. The child will open their mouth and attempt to speak, but there will be no sound coming out. Your child may also display physical behaviors when they stutter, which include abnormal body and head movements, blinking their eyes, tapping their feet, and having tension in their face. If any of these behaviors have been consistently present in your child for some period of time, your child must see a speech-language pathologist. A child who does stutter can also produce normal disfluencies, and these disfluencies are also common in children who don't stutter. Therefore, it is important for you as the parent to differentiate between both types of disfluencies. There are 3 types of normal disfluency behaviors, and they include interjection, revision, abandoned utterances, and multisyllabic or phrase repetition. Interjection is when the child adds extra words such as or while they speak. Revision or abandoned utterance is when the child begins to say something, then either starts to speak about something else, which is abandoned, or will try to correct themselves on something they said before, which is revision. Multisyllabic or phrase repetition is when the child repeats a word with more than 1 syllable. An example would be maybe, maybe. Or phrase repetition, and an example would be let's go now. In order to see if your child does actually stutter, your child will need to be evaluated. One test that can be used to diagnose stuttering is the Stuttering Severity Instrument, 4th edition, which looks at the number of stuttering-like disfluencies your child has and how often they occur. This test will also examine the physical behaviors which are associated with stuttering. Another test, called the Overall Assessment of the Speaker's Experience of Stuttering, will look at how your child feels when they stutter. Does your child tend to feel nervous, scared, or are they fine when they produce these behaviors with different people at the home, school, or other places? This is very important to consider because the child may start to become uncomfortable when speaking and may speak less, which can affect their confidence. Unfortunately, there is no cure for stuttering. There are 2 approaches that can be done to help children who stutter. The first treatment is called fluency shaping, and this is where the child will learn different techniques to modify their speech by reducing or trying to eliminate these stuttering-like disfluencies. These techniques include speaking much slower and pausing more frequently. The child should use both these techniques. The child should be using these techniques often. The second technique is stuttering modification, and both the child and parents should be educated on how to identify when the child stutters. The child will learn to accept their stutter and is then encouraged to stutter. The child can explain to others what stuttering is and what it means to them. This will help the child be less anxious of their stuttering and become more comfortable with it. There are some tips that the parent could use with their children who stutter. The first tip is the parent should speak slowly and pause frequently. This technique is much better than telling the child to slow down when they speak. Also, limit the number of questions you ask your child. Instead, make comments on what your child has said. This will let your child know that you are listening to them. The most important tip of all is to accept and support your child for who they are as a parent.